Hello everyone, it's a pleasure to be here, and I hope everyone is feeling tuned in to know a bit about music therapy, a profession that is small, perhaps uncommon even, but gradually growing to be recognized in Malaysia. For the next 15 minutes, I shall attempt to increase your awareness and understanding of what music therapy is, why and how does it work, and thereafter we look at how it can enhance our experiences as therapy, in therapy, and beyond therapy too. Let's begin with what we generally agree upon. We all like music one way or another. We listen to and feel music. We hear and enjoy music everywhere and in every part of our lives. We know what musical styles we like to hear and what we don't like to hear. Some of us enjoy singing, playing musical instruments. Some of us move to music through dance or exercise. Some of us are musicians, performing music, teaching music, or creating music through songwriting, composing, and arranging. And some of us clinically treat patients or clients with music. This clinically treating patients or clients with music is what we call music therapy. And here in Malaysia, we currently have 17 credentialed and licensed music therapists, all accomplished musicians who have undergone rigorous clinical training, who deliver therapeutic treatment in hospitals, rehabilitation centers, community centers, special schools, aged care homes, and in private practice, working alongside other healthcare and psychological professionals, care managers and staff, school teachers, counselors, and families. As for me, I've been a music therapist for 22 years and currently run an outpatient music therapy clinic at a private hospital in Kota Kinabalu, Sabah, where I see psychiatric patients from diverse backgrounds in mental health conditions. If we reflect on what is music therapy, almost inevitably, two words come up in our minds: feeling and expression. Reading the definition of music therapy from the Malaysian Music Therapy Association, it says that music therapy is the professional use of music and its elements as an intervention in medical, educational, and everyday environments with individuals, groups, families, or communities who seek to optimize their quality of life and improve their physical, social, communicative, emotional, intellectual, and spiritual health and well-being. Research, practice, education, and clinical training in music therapy are based on professional standards according to cultural, social, and political contexts. That to me is a lot more than feeling and expression. In fact, it covers wide areas of life and a multitude of knowledge. No matter, the consensus is that music and its elements is utilized as the active ingredient in therapeutic treatment to manage symptoms, learn, change, develop, cope with daily stresses, or to connect with ourselves and each other. Perhaps in this way, one can begin to see how that fundamental feeling and expression that we ascribe music to links to the feeling within that influences our thoughts and behaviors, with any gradual improvements felt physically, mentally, socially, communicatively, emotionally, intellectually, and spiritually, invariably expressing these improvements towards an optimal quality of life for health and well-being for any given circumstance. What we experience within ourselves manifests in how we express outwards of ourselves. So why music therapy and what for? Let's take a brief historical trip to understand the modern practice and training of music therapy as a regulated healthcare profession that began soon after World War II. During the two World Wars, musicians were brought into hospitals to perform music in an attempt to help soothe and comfort soldiers and civilians affected by and to find healing from the war's effects of losses and traumas. Professional training, therefore, became important for musicians to develop clinically relevant music interventions for patients to manage symptoms in their rehab and recovery. Specialist training programs began in America, Australia, and Europe, and has developed to other countries around the world. Music is indeed a powerful tool to help and enable change. Bypassing the verbal and cognition, it is well suited to process physical sensations of emotions through the tension release principle of music, without the need to verbalize or when verbalizing is a challenge. Resonating with our emotions, it alleviates our loneliness, anxieties, stress. It induces calm, positive emotions, social connection, attentiveness, as we listen deeply, move in time, generate images, memories, and so on. So with that said about music, how then does music therapy work? Now that we are aware of music's role as the active ingredient to facilitate change, it would mean that to bring about shifts and transformations to meet the person's therapeutic treatment goals, the music therapist must know how to use structure, cause interaction, and play with the elements of music: the beat, tone, tempo, meter, rest, timbre, rhythm, and dynamics, individually, in combination, or all together, to help the person who comes for therapy engage with the music through receptive or interactive methods, focusing on symptoms or issues pertaining to the prevailing diagnosis, formulating various procedures, treatment plans, protocols, and clinical frameworks to ensure successful treatment outcomes. Moreover, the experiencing of the music interventions through the therapeutic relationship between client and music therapist, whether these interventions are structured or spontaneous, creative or measured, would give rise to the person's innate abilities to translate these experiences into positive changes that manifest in their feelings, behaviors, social connections, physical control that can be observed by others around them. At this juncture, I would like to highlight that music therapy is guided and driven by research. There are numerous studies published in peer-reviewed journals showing efficacy of music therapy with various clinical populations, ranging from disability to mental health, that further inform the methods and interventions for treating clients. Available in the Cochrane Library are several music therapy and music intervention meta-analyses for cancer, acquired brain injury, coronary heart disease, mechanically ventilated patients, preoperative anxiety, schizophrenia, depression, and autism spectrum disorder. Before continuing to how music therapy can enhance our experiences, I urge us to be mindful of this. As with all tools, mechanisms, and treatment procedures that help towards health, development, and well-being, and the general notion is that music is always a good thing, be aware that it can be potentially harmful too. What is good for one person is not necessarily good for another person. Picture this: you're being forced to listen to music that you simply do not like at all. Imagine what that does to you. Equally, when on your own, if you continuously listen to music that perpetuates a low mood, for example, you might be further reinforcing that mood. This is exactly why in music therapy, the therapist carefully monitors the effects of the music experience so that it reduces engagement in maladaptive behaviors that result from unhelpful experiences. Hence the rationale that music therapists are bound by strict regulations, code of ethics, and standards of practice. I invite you now to visualize with me the following illustrated example. Imagine it's been a long time you've ever felt positive. Sad and heavy are normal for you these days as you're drawn to the melancholy of life. The songs that you listen to, sad lyrics, heavier sounds, and anything positive is dismissed, or any positive feeling quickly pushed aside when felt. But you know that's not how you want to be. In your session, your music therapist invites you to play musical instruments together, perhaps to try some spontaneous sound making. You know this is not easy. You can feel yourself withdrawing from the invitation, but you're also aware from the initial discussion with your therapist that the aim for today's session would be to try to stay with a positive experience and feeling. So you look around the room, aware of the silence, the space, the musical instruments, and the therapist's presence. You see an instrument that you're drawn to, and you decide to sit down at it, as if preparing yourself to try to make just one sound. But you find yourself experiencing within you the hesitation to participate and the pull to withdraw. Then, coming out of the silence, you hear some quiet sounds that your music therapist is playing. And it feels like it seems to match your feeling within of wondering if it's all right for you to participate. The sounds randomly filling the silence until you hear a musical pattern forming that you can attend to and follow along in your mind. Is this a tuning in to something new occurring outside of yourself? Having been more tuned in to withdrawing inwards to yourself for some time now? You begin to be aware of a physical sensation happening within you, and as you listen, you realize a small lifting of heaviness within your chest, and your gaze falls upon your instrument. The hesitation earlier has turned into a readiness to try to respond. You strike a sound on your instrument. Your music therapist copies your sound, and you feel compelled to respond with more. And the beginning of a musical dialogue takes place. It doesn't feel overly positive, but it seems just enough for you to sustain your place and nonverbal participation in this spontaneous musical dialogue as you express yourself in small doses. This dialogue with your music therapist comes to a natural end, and you realize that you were able to stay positive whilst participating in the activity, distracted from any thoughts that may have occurred earlier, allowing a discussion after where you and your therapist then talk about feelings, expression, staying present, noticing your physical, auditory, visual senses in the here and now, aided by the improvisation activity, and how that initial discomfort of hesitance eased into feeling comfortable to engage in an activity that helped you connect socially. Although you may feel tired at the end of the session, your mind and body may remember this positive experience after the therapy session. And that was just a snippet of a music therapy experience. What it demonstrated is how these experiences potentiate multidimensional work, different areas of the brain working together, allowing these experiences to build upon themselves towards improvements and optimizing health and well-being. Whether we think of this generally or personally, I must emphasize that there is no one-size-fits-all, or a prescription playlist or intervention, because music therapy is process-oriented. A music therapist will formulate individualized treatments, continually monitoring and adjusting within and through the therapeutic relationship. Each person's subjective experience unique to their strengths, needs, and goals. And finally, it is indeed an honor to be included as a participant in a person's therapeutic journey. To bear witness to transformations is simply beyond measure. And with that, I say thank you very much to the TEDx team for inviting me to speak. Thank you, everyone.